Okay, so taking oral temperature using our model that we have, it turns on automatically when you pull the probe out. So you'll put a probe cover on from the box, making sure that you don't touch the cover with your fingers. And then you make sure that your monitor is set on oral. You can use the picture of the person to change it between oral, adult axillary, and pediatric axillary. So go ahead and have your patient open their mouth, lift their tongue, place the thermometer under their tongue, have them place their tongue against the bottom of their mouth and close their lips tightly. And you'll go for either 3 minutes or until it beeps and open. So it gave us a temperature of 98.6. We would go ahead and repeat that if we suspected that they had a fever or they had a high temperature. With this one, to repeat it or to turn it off, you have to take the probe off, put it back in, wait till it turns off, and then take it out again. So for an axillary temperature reading, same thing, take your thermometer out of the case, place a probe cover on without touching the probe with your fingers. Make sure that you're set on adult axillary by pushing the person button, and then have the patient place the probe tightly under their armpit and then clamp their arm firmly against their body. Again, we'll hold it until it beeps. Or for 3 minutes, whichever happens first. So 98.4. Again, if we suspected a fever or if our temperature reading came back high, we would repeat, take the probe off, put it back in, and then repeat your temperature reading again. We're going to go over palpating lymph nodes. So typically if we're dealing with anything systemic, we're going to start up in the cervical area and the jaw. Okay? You want to make sure that you palpate bilaterally, and again using a really soft touch. They're fairly superficial and they could be quite tender. So we're going to start up just below the ears, okay, and we're going to slowly work our way down underneath the jawline. You want to kind of move your fingers in different directions, so you can move up and down, side to side. Again, just looking for small, palpable little nodules. Okay, you can work your way down the front of the throat and the sides, behind the scalenes and sternocleidomastoid. Okay. Then we can come down into the pec region. So starting on this side, we're going to have them bring their arms slightly to the outside, and then you're going to follow the pec tendon down into the pec muscle. Again, same thing, fairly gentle because they'll be quite superficial. Okay, and we would palpate both sides, and then go ahead and lay back. To go through the armpit, in the axillary region, you'll start again on that pec tendon, and then just slowly work your way down, and then medially into the armpit and towards the body. And then when you get to the lat, you'll start to move inferior. Again, just gentle pressure, move your finger in a number of different directions. We can also do in the elbow, so same thing, we'll go on the medial aspect of the elbow. Just gentle movements kind of along the UCL region. Okay. And then we want to move into the groin. So with the groin, you're going to start kind of on the iliac crest, and then you can move your way down, kind of following the inguinal line. Again, gentle pressure, and make sure that you communicate with your patient, obviously, before you start palpating in the groin. Most of the time, we wouldn't need to palpate this region unless we were concerned with an STD or some kind of urogenital condition. Usually we can go with the lymph nodes that are more in the cervical region for systemic conditions.